Hi, welcome to this episode of Patient Education for the Educated Patient. This episode, we're going to talk about pregnancy and sushi. A lot of different answers out there, and I'll try to give you the details so you can make the best choices for you and your baby. Let's get started. So again, we're going to start with the take-home points so you don't have to try to skip to the end of the video. Take-home points here are very straightforward. Number one, sushi is safe in moderation. Number two, you must watch your total mercury intake. And that's not just with sushi, that's your total dietary mercury intake. That can be cooked fish, raw fish, sushi, sashimi, poke, whatever. It's your total intake of mercury that is important when you're pregnant. And number three, don't eat bad sushi. So, food poisoning and pregnancy. There's two things that you have to consider when you are pregnant and you're watching your diet. The first is food poisoning. And the second is what I'm eating bad for the baby? Food poisoning is important in pregnancy because your immune system is turned somewhat down while you are pregnant. A lot of medical literature will consider immunocompromised patients to be children, old people, people on immunosuppressive drugs like autoimmune disorders, cancer, transplant recipients. And guess what? Pregnant women are lumped into that same category. So that means you are more susceptible to gastroenteritis or food poisoning because you have a, quote, weaker stomach when you're pregnant. And not only are you more sensitive to food poisoning and gastroenteritis, it tends to be much more severe. When you're not pregnant, you get food poisoning, you may have nausea, vomiting, some diarrhea for a 24 to 48 hour period. You stay hydrated, you will be fine and you will recover. However, in pregnancy, it's much, much more difficult. The symptoms are much more severe. It's harder to keep food down. It's harder to stay hydrated by just drinking a lot of fluids and electrolytes. So oftentimes people with gastroenteritis or food poisoning when they're pregnant wind up admitted to the hospital for IV hydration and IV vitamins and IV anti-nausea medicines. So that's one factor or one consideration when you are pregnant is to avoid food poisoning. Now, the second aspect is this food bad for the baby? And so there is some suggestion that morning sickness is some sort of evolutionary adaptation to protect the growing fetus, that you have an aversion to certain foods for a reason. So that being said, you should always listen to your body. A lot of times your body knows best or nature knows best. The second thing is that sushi and sashimi contain mercury. And this is the factor that can make it bad for babies and developing fetuses. And that's what we'll explore here. There's other things that can be considered bad for baby in pregnancy, such as listeria poisoning or salmonella poisoning or vitamin A toxicity, for example. But those can be discussed at a separate video. In this sushi video, we're going to focus on mercury. So, mercury toxicity can basically make you crazy. If you think about the saying, mad as a hatter came from the saying when people used to make hats used certain chemicals that contained organic mercury that was highly toxic and it would drive them crazy. And so this became a thing, mad as a hatter. Now, sushi and sashimi, again, kind of have a dual threat when it comes to pregnant women. Number one is raw, so it has a high propensity to cause food poisoning. And number two, it contains mercury. So it can both cause food poisoning and also be a danger to your baby in excessive quantities. Sushi is a dual threat. It's raw, so it has a propensity to cause food poisoning or gastroenteritis. And it also contains mercury, which in high doses can be toxic to you and the baby. What does the FDA say about fish in pregnancy? The FDA is a big advocate for a healthy amount of fish intake when you're pregnant. This is because a lot of the omega-3 fatty acids that are largely found in your fish portion of your diet are healthy for pregnant women and the baby, the developing brain of the baby, etc. So it does recommend you continue to consume fish in pregnancy. Now, that being said, you do have to watch your total intake of fish because you don't want too much mercury. So again, this is not an extreme thing. Yes, fish is good, but don't eat tons of fish. Yes, there's some mercury in fish, but don't eat zero fish. So that's the balance you got to strike. And that's a constant theme you'll see in these videos, is that you have to do things in moderation. And that's very hard to do for some patients because we live in a society of extremes. But in pregnancy, again, you want to focus on the Goldilocks principle. Not too much and not too little. It has to be just right. So the FDA puts out this flyer and it breaks the different types of common fish into best choices, good choices, and choices to avoid. And so you really want to try to commit the choices to avoid to memory, because that is increasingly difficult. This section right down here is the one you want to focus on. When I was in medical school, there was only 4 fish on this list: king mackerel, shark, swordfish, and tilefish. But as you can see, they've expanded it to include 7 total fish to completely avoid while you are pregnant. Other than that, they do recommend for the best choices to have 2 to 3 servings per week, and the good choices to only have 1 serving per week. For the FDA, 1 serving of fish is approximately 4 ounces, and they say to visualize that as the palm of your hand. If you look at canned tuna from the grocery store, that's typically between 3 and 5 ounces of fish at a time, or approximately 1 serving. So if you look at here, you can have 2 to 3 servings per week of these best choice fishes, and then 1 serving per week for these good choices. So again, if you're going to have healthy sushi during pregnancy, you don't want to have too much of it, and you want to make sure that you're not exceeding the total intake of mercury for that week. So remember, mercury is mercury. Mercury is an element. That means cooking it is not going to kill it. It's not going to metabolize. It's not going to change. It's not going to get broken down by your liver or, processed by your body in any way. Mercury is an element. So it doesn't matter if the fish is cooked or not cooked or seared on the outside. It's not like food poisoning with bacteria. Mercury is not something you can kill off, and that's why you just have to monitor your total mercury intake. And that's why technically sushi or sashimi is acceptable in pregnancy from a mercury standpoint, because it doesn't matter if the fish is cooked or not. Now, this is the basic concept for the concentration of mercury as it goes up the food chain. And that's why if you look at that FDA flyer for the good choices of fish, the best choices of fish, and the fish to avoid, the fish at the top of the food chain, or the larger fish, tend to be the ones that you should avoid altogether because their mercury content will be too high. And the reason that happens is because the fish here at the bottom of the food chain, they tend to have a little bit of mercury, but then as they get eaten by the fish above them, the mercury concentrates bigger and then ultimately bigger until you're at the top of the food chain, and those fish have entirely too much mercury to safely consume in pregnancy at all. Back to the take-home points. Number 1, sushi is safe in moderation. Number 2, you must watch your total mercury intake when you are pregnant. And number 3, don't eat bad sushi. And again, that can mean multiple things. You want to go to a sushi restaurant that is reputable, has a lot of customers so that there's a high turnover of their supply of fish. That way it stays fresh. There's some people that say fish markets aren't open on Saturday and Sunday, so don't get sushi on Saturday or Sunday and wait until Tuesday so that the sushi chef has had a chance to go to the market on Monday and kind of refill their supply of fresh fish. I don't know how true that is, but that's something you may want to ask your local favorite sushi chef. That concludes this episode of Patient Education for the Educated Patient. Thank you, and stay educated. Thank you for watching this episode of Patient Education for the Educated Patient. I hope you found this content both helpful and meaningful. and that you'll be able to use it to live a healthier life. If there's any questions, please leave them in the comments section below. I do welcome feedback, so please also leave me any comments or suggestions in the comments section. Please subscribe and turn on the notifications, and I hope to see you at the next episode. Until then, stay healthy and stay educated.